Good morning. I'm Bruce Stevenson. I'm the guy on the right, and the person on the left is Linda Piccinini, and together we are Today's Dental Consulting. We are a dental consulting firm that only works with offices using Open Dental. So what I'm going to show you in this little video is going to use Open Dental as an example, but other software will have similar problems. The problem is it's very easy to make mistakes, and it's very common for staff to make mistakes when trying to estimate how much the insurance is going to cover. And we find the couple errors that I'm going to show you right now as being very, very common out there. Staff simply does not understand why these occur and how to correct them. And you know what, doctor? That's your fault. Your staff needs to get training on how to deal with dental insurance in this day and age. It is so different than it was 10 years ago. And a lot of staff, unfortunately, doesn't know how to deal with these things. There's not very much training available. In the case of Open Dental, there's lots and lots of good videos, both from Open Dental and from us, including this one, if I might say so. So what are the common errors and what do they cause? They cause angry patients. And the two sources of the common errors are the fee schedules and the posterior composite coverage. So you don't want a pissed off duck in your practice. So we want to do these things right. So let me show you both the errors and why the errors occur and how to deal with them. In Open Dental, you can deal with insurance plans two different ways. Either as a PPO percentage, which is what we prefer because it has a lot of advantages, we think, when it comes to case presentation, or as category percentage. I'm going to show you the mistakes that happen. They appear a little bit differently depending upon how you set these things up. If you're not using Open Dental, you don't have PPO percentage. That's an advantage of Open Dental. You have the category percentages, and I'll show you how the errors look there in just a second. So we'll set Donald up here with PPO percentage, and we'll set his fee schedule in there for the Delta fee schedule. When we put a treatment plan in, you notice something looks kind of odd. Here's our fees. In the case of PPO percentage, those are going to be our UCR fees. But look at the discount Donald gets. Donald is getting a discount of 100%, so his portion is going to be 0. Now this is the error that I'm going to show you. When you're ending up with zeros in funny places, like how much the patient's going to owe you, it means there's a problem in the fee schedule. So let's go look at the fee schedule for composites. Here is our UCR fee, and here is the Delta fee. There isn't one. It's 0. So somebody neglected to put the Delta fee in that fee schedule. Okay, you've got to make sure that your fee schedules are correct. Most of the time, the bigger insurance companies like Delta or Aetna or so forth will tend to send you about 300 fees for 300 different fee schedules, but not always. And just because they send it to you, and that's your contracted allowance, doesn't mean that somebody put it in the computer correctly. So you need to check on these things. When you find zeros, this is the cause right here. You've got to go in and put the correct fee in the fee schedule. You've got the fee in the UCR fee schedule, but in this case you don't have it in the Delta fee schedule. How's this look with category percentage? Now, category percentage is the way all other software does it, to the best of my knowledge, except Open Dental. Open Dental gives you the choice. In category percentage, again, we don't have a fee in there, and so all these are zeros. Okay, which is going to make all these zeros. So here you're doing all this treatment, and it's coming out the patient's estimated portion is going to be 0. You know, when you turn around and actually do the treatment, bill for it, and get paid, the patient's going to get a nasty surprise. So the take-home message is watch for the zeros. And when you're getting zeros in funny places, it usually means your fee schedule isn't correct. Don't get a pissed off duck in your practice. Watch for the zeros. Okay, what else? Let's go back, and we're going to fix that little mistake in there. There we go. All right, and now we're looking at the treatment plan again. and it is doing an estimate here. But how did it arrive at this number over here? Where did this number come from? Well, it depends on how you have this set up. If you look over here, we've got these little X's. This is very confusing to me. I don't know. Maybe it's because I'm old. But, you know, to me, this is like a double negative, and it's just backwards of the way it should be. But let me tell you the way it is. Okay, when this substitute is checked, it means it will substitute the allowance for amalgam instead of composite. So, in this case, if this was an amalgam, if this was an MOD amalgam, the insurance is estimated to pay $38.40. Okay. However, you're charging $290. That's your UCR fee for an amalgam. Okay. That's where this comes from. Sometimes it's a good idea to do that substitution. Okay. But not always. This will tend to make your estimates underestimate the insurance and overestimate the patient's portion. That's probably a good thing. If you're going to make a mistake, you want to make it in that direction rather than having to go back to the patient for more money. So let's look at, that's what we're talking about right there, are those two X's in the substitute column. In the insurance setup, we got to go over to the other tab now and open dental. And this is where you didn't used to have to do this. This is in the new version. This is where you're going to put that X, okay? So don't substitute codes. It's blank, so you do substitute codes. This is what's backwards to me, okay? So it's blank, so you are going to substitute the codes, okay? If it's got an X in there, you're not going to substitute the codes, okay? Got that? Again, it's just play with it a little bit, and you'll probably understand it better. All right, so there's that thing right up there, do or don't substitute. And this pretty much just pertains to posterior composites. So if you don't substitute the code, it's going to assume it's going to pay posterior composites at whatever percentage it pays restorative at. Okay, in this case, we took the X out. We're not substituting, and it's going to pay composites, it's going to estimate composites at 80%. But how do you know? How do you know how they handle posterior composites? I can tell you from experience that most of the time for Delta plans, they do not reduce your fee to amalgam for posterior composites. And that's getting to be more common with other insurance companies. But there still are a lot of plans out there that do reduce your payment to amalgam. Doesn't mean you can't charge the patient the difference. It just means that you want to estimate correctly. Okay. So how do you find out, how this particular insurance plan handles that? Well, one way is to use Trojan. If you're in an area of the country where Trojan works, this is really pretty handy. And you have a thing in Trojan called the Trojan Notes. And part of the Trojan Notes, right down there, it says that posterior composites are paid as posterior composites, not as amalgams, and they're paid at basic. And we know what our basic percentage is. So that's how you tell that. There's other ways, but that's a good way. So if you're in doubt, don't check the box. Okay? I'm sorry. Yeah, do not check the box. This confuses me so much and probably confuses you too. If you do not check the box, then it will substitute the codes. Okay? So it will estimate them as if they're amalgams. Okay? And to be safe, you probably want to do that. Okay, so we don't want angry patients, we want happy patients. And you do that by accurately estimating your insurance, having your fee schedules correct in there, understanding, even with my confusing explanation, about how those posterior composites are covered. When you don't have to pre-estimate, because you can do an accurate pre-estimate in your office, it's just a lot of people don't know how to do it. Sending out pre-estimates costs you about 40% of your production. So by not sending out pre-estimates and doing accurate estimates in your office, you do more treatment. Okay, and you can do it now. You can do same-day dentistry, and you create happy patients. So if this is helpful to you, we've got a lot more videos on our website, todaysdentalconsulting.com, And we also do a lot of training and consulting. So you can give Linda a call at 209-603-9944 or just look on our website.